Children with disabilities have the same rights as any other girl or boy. They have the potential to lead fulfilling lives and to contribute to the social, cultural, and economic vitality of their communities. Yet, it can be especially difficult. They are at greater risk of being poor. Even where children share the same disadvantages, children with disabilities confront additional challenges. Children living in poverty are among the least likely to enjoy education and healthcare, but children who live in poverty and have a disability are even less likely to attend the local school or clinic. In many countries, responses to the situation of children with disabilities are limited to institutionalization, abandonment, or neglect. These responses are rooted in negative or paternalistic assumptions of incapacity, dependency, and difference perpetuated by ignorance. What is needed is a commitment to these children's rights and their futures, giving priority to the most disadvantaged as a matter of equity and for the benefits of all. Children with disabilities encounter different forms of exclusion and are affected by them to varying degrees, depending on the type of disability they have, where they live, and the culture or class to which they belong. Gender is also a crucial factor. Girls with disabilities are less likely to get an education or find employment than boys with disabilities or girls without disabilities. Exclusion often stems from invisibility. Few countries have reliable information on how many of their citizens are children with disabilities, what disabilities they have, or how these disabilities affect their lives. Children are thus cut off from the public services to which they are entitled. These deprivations can have lasting effects. The future is far from grim. Through the Convention on the Rights of the Child, CRC, and the Convention on the Rights of Persons with Disabilities, CRPD, governments have assumed the responsibility of ensuring that all children, irrespective of ability or disability, enjoy their rights without discrimination of any kind. Inclusion must be the goal. It goes beyond integration. To take an example from the field of education, integration might be attempted simply by admitting children with disabilities to regular schools. Inclusion, however, is possible only when schools are designed and administered so that all children can learn and play together. Inclusion benefits everyone. To continue with the example of education, ramps and wide doorways can enhance access and safety for all children, teachers, parents, and visitors, not just those who use wheelchairs. In efforts to promote fairness, children with disabilities should be able to enlist the support of their families, disabled people's organizations, parents' associations, and community groups. They should also be able to count on allies further afield. Governments have the power to help by aligning their policies and programs with the CRPD and CRC. The private sector can advance inclusion and attract the best talent by embracing diversity in hiring. By one estimate, some 93 million children, or 1 in 20 of those aged 14 or younger, live with a disability of some kind. Such global estimates are essentially speculative. They are dated and derived from data of quality too varied and methods too inconsistent to be reliable. Research is improving data collection and analysis. Their work will help to overcome ignorance and discrimination, to target resources and gauge their effects. But decision makers need not wait for better data to begin building more inclusive infrastructure and services. All that is needed is for these efforts to remain flexible so they can be adapted as new data come to light. The CRC and CRPD demand recognition of each child as a full member of her or his society. This entails a focus not on rescuing the child, but on removing the physical, cultural, economic, communication, and mobility barriers that impede the realization of the child's rights, including the right to make decisions about their own lives. Little will change in the lives of children with disabilities unless attitudes change. Bringing disability into political and social discourse makes it possible for education decision makers and service providers to demonstrate that disability is part of the human condition. The importance of involving children with disabilities cannot be overstated. Prejudice can be reduced through interaction. Social integration benefits everyone, and children who have experienced inclusion in education, for example, can then be society's best teachers in building an inclusive society. Social integration has many aspects, ranging from inclusion in media and cultural life to sport. Children with disabilities and their families have the right to an adequate standard of living and are also entitled to daycare, respite care, and self-help groups. Social protection for children with disabilities and their families is especially important because these families often face a higher cost of living. A review of 14 developing countries found that people with disabilities were more likely to experience poverty than those without disabilities. States can tackle the increased risk of child poverty with initiatives such as cash transfer programs. A growing number of low and middle income countries are building on promising results. Routine monitoring and evaluation will be essential to make sure these programs achieve their objectives. Disability-specific budgeting is where a government sets specific goals for children with disabilities and allocates a sufficient portion of the available resources. Education, healthcare, habilitation, rehabilitation, and recreation should be provided free of charge and in a manner that promotes the integration and development of the child. Community-based rehabilitation programs seek to ensure that people with disabilities have equal access to services and opportunities. They are designed and run by local communities, with the active participation of children and adults with disabilities. Interventions often appear small, such as when communities come together to build wheelchair ramps or negotiate with local hospitals for free services. But by improving access to education or health, they generate benefits that last a lifetime. Depending on the type of disability, a child may need an assistive device, such as a prosthesis or a service such as a sign language interpreter, to function fully. According to the World Health Organization, in many low-income countries, only between 5 to 15% of those who need assistive technology can get it. Assistive technology and any other support should be free and available to all. The cost of making new buildings accessible can be negligible, amounting to less than 1% of the cost. By contrast, retrofitting can cost as much as 20% of the original price. Health and education play a critical role in building a solid foundation on which children with disabilities can live fulfilling lives. Children with disabilities are entitled to the full spectrum of care, from immunization in infancy to proper nutrition and treatment for childhood ailments and injuries, to sexual and reproductive health information. Equally critical are water, sanitation, and hygiene. Ensuring that children with disabilities enjoy these rights is important. It is a matter of social justice and of respecting the inherent dignity of all human beings. More children than ever before are being reached with immunization, but children with disabilities are not benefiting from increased coverage. Universal coverage cannot be reached if they remain excluded. While immunization can prevent some diseases that lead to disabilities, it is also important to immunize children who are already disabled. Insufficient food or a diet short of certain vitamins and minerals can leave infants and children vulnerable. Between 250,000 and 500,000 children are at risk of blindness each year from vitamin A deficiency. This is easily and cheaply prevented. Poor nutrition and diarrhea in early childhood can lead to stunting, indicated by low height for age, which in turn can result in poor lifelong cognitive and educational performance. Malnutrition in mothers can contribute to a number of preventable childhood disabilities. While malnutrition can be a cause of a disability, it can also be a consequence. Children with disabilities are at heightened risk of malnutrition. But because they are hidden away from community screening initiatives or do not attend school, many miss out on feeding programs. Children and young people with disabilities have been almost entirely overlooked in sexual and reproductive health and HIV/AIDS programs, as they are often incorrectly believed to be sexually inactive, unlikely to use substances, and at less risk of violence than their peers without disabilities. In fact, they are at increased risk of HIV infection. The detection and treatment of impairments is an integral aspect of public health and should be initiated as early as possible because children develop rapidly during the first 3 years of life. When policymakers and researchers characterize these measures as being in competition for resources, they perpetuate discrimination and inequity. Healthcare services available to children with disabilities may be poor. Health workers and families stand to benefit from being educated about child development and disability. Children with disabilities are also disproportionately denied their right to education. Household surveys in 13 low and middle income countries show that children with disabilities aged 6 to 17 years are significantly less likely to be enrolled in school than their peers without disabilities. Rather than segregating children with disabilities in special schools, inclusive education allows children with and without disabilities to attend the same classes with additional support as needed. It requires physical accommodation as well as a new child-centered curriculum that reflects the needs of all children. Inclusion begins at home. Without the love and care to which they are entitled, children can miss important developmental milestones and their potential may be limited. In schools, teachers must have a clear understanding of inclusive education and a commitment to teaching all children. Resources for children with disabilities tend to go to segregated schools rather than to an inclusive mainstream system. This is inappropriate and can prove costly. When teachers and personnel are trained to, they look upon inclusion of children with disabilities more positively. The lack of people with disabilities among teaching personnel presents another challenge to inclusive education. Adults with disabilities often face considerable obstacles to qualifying as teachers. Teachers often have inadequate support in the classroom, and they need to be able to call on specialist help when the needs are beyond their expertise. These specialists are in short supply, especially in such low-income areas as sub-Saharan Africa. The most underused resource in schools and communities all over the world is the children themselves. Involving children with disabilities in decisions can be particularly challenging because ingrained thinking perceives them as passive victims. Inclusive health and education reinforce each other. Basic reading and writing skills also improve health. A child born to a mother who can read is 50% more likely to survive past the age of 5. And lower maternal education has been linked to higher rates of stunting among children in urban slums in Kenya, Roma settlements in Serbia, and in Cambodia. In some societies, many children with disabilities are not even able to obtain an identity document. This renders them invisible to officialdom and increases their vulnerability to exploitation. Discrimination against and exclusion of children with disabilities renders them disproportionately vulnerable to violence, neglect, and abuse. Some forms of violence are specific to children with disabilities. In many countries, children with disabilities continue to be placed in institutions. It is rare for these facilities to provide the individual attention that children need to develop to their full capacity. The educational, medical, and rehabilitative care they receive is often insufficient. Separating children with disabilities from their families is a violation of their right to be cared for by their families. If immediate family is unable to care for a child, the CRPD obligates states to provide alternative care within the extended family or community. Humanitarian crises pose particular risk for children with disabilities. Inclusive humanitarian response is urgently needed. Armed conflict is a major cause of disability among children whom it affects in direct and indirect ways. Children sustain injuries from attack. They also suffer psychological effects from these injuries or from witnessing traumatic events. Indirect effects include illnesses untreated when health services break down and malnutrition that develops when food becomes scarce. Extra care is needed to ensure that children with disabilities are not excluded from early warning systems and assistance. A society cannot be equitable unless all children are included, and children with disabilities cannot be included unless sound data collection and analysis render them visible. Measuring child disability presents unique challenges. Because children develop and learn at different speeds, it can be difficult to assess variations in normal development. The varying nature and severity of disabilities, together with the need to apply age-specific definitions and measures, further complicate data collection. While there is general agreement that definitions of disability should incorporate both medical and social determinants, the measurement of disability is still predominantly medical, with a focus on specific physical and mental impairments. One framework for considering health and disability within a broader context of social barriers is the International Classification of Functioning, Disability, and Health, or ICF, developed by the World Health Organization. The classification regards disability in two main ways: as a matter of the body structure and functions, and in terms of the person's activity and participation. Disability, as defined by the ICF, is an ordinary part of human existence. Every person can experience some degree of it. The ICF definition also recognizes that functioning and disability occur in context, and therefore it is meaningful to assess bodily and also societal and environmental factors. Derived from the ICF, the International Classification of Functioning, Disability, and Health for Children and Youth captures not only the impairment, but also its effect on children's participation in their environment. It covers four main areas: body structures, body functions, limitations on activity, and restrictions on participation. The specific objectives of data collection are also likely to influence the definition of disability, the questions asked, and the resulting figures. The criteria used to define eligibility for disability benefits are likely to be more restrictive than criteria for a survey conducted to identify all persons with a functional limitation, therefore yielding dramatically different numbers. Many children are identified as having a disability when they come into contact with education or healthcare systems. But in low-income countries or communities, school and clinic staff may not be able to routinely recognize or register children with disabilities. The lack of information on children with disabilities in low-income countries has contributed to a misconception that disability does not merit global priority. Efforts to measure child disability represent an opportunity to link assessments with intervention strategies. Though early intervention is critical, capacity and resources for follow-up assessments and support for children who screen positive for disability are often scarce. Data should capture the following: the type and severity of children's disabilities, the barriers to children's functioning and participation, and the relevant socioeconomic indicators. This will help to inform decisions about how to allocate resources and meaningfully evaluate them. Data can be used to map whether income, gender, or minority status affects access to education or immunization for children with disabilities. UNICEF is working with governments, universities, and international partners to do just this, and to develop tools to strengthen local capacity to identify and assess children with disabilities who are at risk of social exclusion. In the meantime, the fragmented state of child disability data is no excuse to defer meaningful action. As new data and analysis emerge, they will present opportunities to adapt existing and planned programs for children with disabilities and their families. As the nations of the world have repeatedly affirmed their commitment to building more inclusive societies, the situation of many children with disabilities and their families has improved. Even so, too many children with disabilities continue to face barriers to their participation in the civic, social, and cultural affairs of their communities. Realizing the promise of equity through inclusion will require action to ratify and implement the Convention on the Rights of Persons with Disabilities and the Convention on the Rights of the Child. Fight discrimination and enhance the awareness of disability among the general public, decision makers, and those who provide essential services. Dismantle barriers to inclusion so that all children's environments, schools, health facilities, public transport encourage children with disabilities to use the same facilities as their peers. And the institutionalization of children with disabilities, starting with a moratorium on new admissions. Support families so they can meet the higher cost of living associated with caring for children with disabilities. Move beyond minimum standards by involving children and adolescents with disabilities and their families in evaluating supports and services designed to meet their needs. Coordinate services to address the full range of challenges facing children and adolescents with disabilities and their families. Involve children and adolescents with disabilities in making decisions that affect them. Promote a concerted global research agenda on disability to generate the reliable and comparable data needed to guide planning and resource allocation, and to place children with disabilities more clearly on the development agenda.